Today is 3/17. I have a patient here, 252402. It is a 25-year-old female with no concerns. They are presenting to clinic today for nutritional counseling. Thank you for coming to the clinic today and bringing your 5-day dietary recording that you had done. So today we will be using that in correlation with your dental habits, as well as determining any benefits or concerns with dental relations here. So we went over your medical history and everything looks normal, no changes from last time. We also went over your vital signs and everything looked very normal for today. So we will continue on to reevaluating your extraoral exam today and looking at all of the notifications here. Everything looks very normal, as well as your intraoral exam, which is just looking inside your mouth, and that looks very normal for today as well. So it looks like no changes from last time, which is very good. So when it comes to your diet, as well as in relations to caries and periodontal disease, they all relate in a way. Even though I am a dental hygienist and I clean teeth all day, it is also my job to educate you on what are things that can create cavities and what are things that will contribute to periodontal disease as well. So first off, we will start off with your caries classification and your plaque index here. So looking at your diet that you have here on the computer, you do eat 3 times a day and snack 1 time a day, which is really good, as well as you do brush 2 times a day and you do floss 1 time a day, which is also very, very good, because when you brush and floss often, it helps get rid of that bacteria that builds up on your teeth, and that's very good. So with that being said, when bacteria forms, it relates with carbohydrates, bacteria, as well as susceptible teeth and due to time. So over time, when your tooth has bacteria sitting on the tooth, then it will cause that bacteria to create acids, and then it will cause caries. So I have an example here on this chart. So on this chart, it shows the things that you can eat to cause caries from happening. So like not brushing your teeth often, also fluoridated substances like water or toothpaste, as well as sugary and carbohydrates like we listed earlier, and also, believe it or not, your tooth morphology. So depending on how your teeth sit next to each other, that can also cause cavities to form in those areas due to then overlap, and it's harder to reach those areas. So that's more common as well. So back here, it just shows, like I was talking earlier, shows bacteria that's already in your mouth. And then once we introduce those foods to that bacteria, it causes acid. And once that acid is formed, and if we leave it sit on our teeth for a long amount of time here, then it causes that tooth to be susceptible to caries, as well as periodontally involved tissues. So that's something we want to prevent from happening. So now we will move on to what is biofilm. So here, as you can see here, biofilm is a thin layer of bacteria that is sticky and slimy that sits on your teeth. When we don't remove that sticky substance from our teeth and we leave it on all the time, it causes that acid to form like we talked about earlier. And once that acid forms, it eats at your teeth, or otherwise it gets into those grooves of your tissues and causes periodontal disease, which can turn really bad, and we want to prevent that from happening. So now we will go ahead and talk about things that can also remineralize our teeth. So even though the foods that we eat will demineralize our teeth, like break it down if we don't take care of our teeth, if we introduce fluoride or fluoridated toothpaste or fluoridated water, it will remineralize our teeth and cause our teeth to become stronger and be able to fight those bacteria. And that just allows for our teeth to have a longer life in our mouth. So that's a very, very good thing that would happen here. So in your diet here, it shows in red here all the sugary foods that you do consume. So that can be due to like drinking soda, drinking coffee with creamer, as well as your dressings or your sauces that you eat. They do contain some sugary foods. You do also show signs of eating carcinogenic foods as well in your diet. A few things that are carcinogenic foods are more like starchy foods, like your bread, your rice, as well as sugary foods like your soda, your dressings, your the salsa that you eat. So those things that are sticky and softer will be considered as carcinogenic foods. So here, I'm just showing what a carcinogenic bacteria is. So a carcinogenic bacteria is bacteria that likes to stick onto your tooth. So in this picture here, it shows the carcinogenic bacteria sitting around it, and it's sticking onto that tooth. And that tooth is very inflamed, it's not happy. So it is very important to be able to brush and floss and remove that carcinogenic foods from staying on those teeth, because in your diet, when you do have softer substances or softer foods, those like to stick onto your teeth, as well as sugary drinks, those like to stick on your teeth as well. So it's very important for us to be able to rinse with fluoridated water, as well as to be able to floss, brush our teeth, to be able to remove all of that from our mouth is very important too. As well as, even though you do just snack one time a day, it is also very important to be able to drink water and flush that snack away from your teeth, because the longer it sits on the teeth, the more it will affect your teeth. So it's very important to do that as well. And also, if you do need to do sugar-free gum, that will help stimulate saliva, and the more saliva we have in our mouth, the better it is, because saliva helps fight off bacteria, and it also helps to allow us to be able to flush out bacteria in our mouth as well. So that also helps. Other things that you can use besides just regular floss and regular manual toothbrush is to use an electric toothbrush at a 45-degree angle, so kind of tilt it up or tilt it down depending on where you're going to use it, and to be able to have that just sit in those areas for a few seconds, to be able to face more towards the gum line, to be able to get those bacteria out of those hard to reach areas. So it's very important to do 45-degree angles. As well as when you're flossing, make sure you do a C shape. C shapes is very important. So when you're flossing down, seesawing it down in between your teeth, it's very important to be able to go down all the way down into that tissue and kind of pull up all the bacteria that is stuck down there. So in that way, we are trying to help the tissues from being healthy and trying to help them to be able to breathe a little, if you want to think about it like that. So it is very important to be able to floss all the way down there, as well as to use soft picks if you need those, as well as I do recommend reach floss for molars all the way in the back when it's harder to reach as well, because those are not easy to reach. And also being able to use a water pick in conjunction with the floss. So a water pick is very important to be able to flush that tissue out with the bacteria to be able to leave that area. To do that, it will allow that tissue to kind of heal and to be stable, and that's very important too. So after we've talked about brushing and flossing, it is also very important to also use a fluoridated toothpaste like Colgate, Crest, and you can use sensitive toothpaste from Colgate or Crest as well, whatever works for you. Some people use Sensodyne too, because that works for them. So any type of toothpaste that has some percentage of fluoride in it will help remineralize that teeth, like we talked about earlier. And that would help, because then it makes your teeth stay stronger and healthier, which is what we want to happen. So that's also a bonus to making sure we keep our teeth clean. And even though you only see the dentist every 6 months, it is very important to make sure you continue to do your home care, continue to brush your teeth, continue to floss, continue to use fluoridated toothpaste, continue to do mouth rinses to kind of help that tissue stay healthy, as well as to maintain those levels there. Because if you're not doing home care and you come to the dentist, then the results will be a little different. And I want to talk about the periodontally involved bacteria that does happen to some people, so that you're aware. Is so for bacteria, when they get stuck inside the tissues of your teeth, it becomes periodontally involved. So like in this flip chart here, it shows your teeth from going from healthy to gingivitis to periodontitis. So we always recommend for you to make sure you keep your teeth clean to stay at the healthy teeth here. But sometimes I understand it's very hard to be able to maintain brushing 2 times a day and flossing 1 time a day. As our life gets busy, work gets busy, school gets busy, just life gets busy. So sometimes it's not manageable. But I do want to educate you on knowing that when we have periodontally involved teeth, the bacteria are sitting inside our gum tissue, like in this image here. So the bacteria is sitting inside that gum tissue. And when that bacteria sits inside that gum tissue, it causes that gum tissue to be irritated. So when that gum tissue is irritated and we don't and you don't go to the dentist to get that checked up, or as well as you don't do home care to kind of maintain that level, then it causes that tissue to kind of reduce and also causes bone loss. So when you have periodontally involved teeth, it causes bone loss. When bone is lost in your teeth, then it also doesn't grow back. And that's something that's really hard for a lot of patients to find out. So, me educating you today will hopefully help you maintain the level that you're at right now with your teeth. So, when a person gets periodontally involved bone loss, then the only thing we can really do is to be able to maintain those bone levels. And that requires for the patient to come in every 3 months, every 4 months to get deep cleanings to be able to get all that bacteria out of that tissue. And once those bacteria is out of that tissue, that gum tissue is able to adhere to that tooth and causes that tissue to kind of heal up, which is what we want to see. So that's very important to know the difference between just a cavity forming bacteria and a periodontally involved bacteria. So in your food guide here, I see that you do eat vegetables, but you mainly eat it at dinner time. So it's very important to kind of incorporate vegetables more often into your lunch or your breakfast or during a snack. So fruits is also another way to be able to get a natural consumption of sugar, and we aren't adding artificial sugar into our diet here to kind of help maintain with bacteria from overproduction in the dentition. So those are 2 things that I would recommend you to focus on eating to kind of help with being able to get healthier things introduced into your dentition. So there's that. So today we just discuss about a lot of things in relation to your dentition, to bacteria forming that causes cavities, as well as bacteria that causes periodontal disease, and also your diet here, determining how often you snack and determining foods that you are lacking that you should consume more often. Did you have any questions for today at all? No, okay. Well, if you ever have any questions, feel free to call the office, and we're always here to answer any of your questions because we did go through a lot today. So always reach out and let us know. Is there a plan that you want to develop for next time? Okay, so you do want to focus on eating healthier foods like those veggies and fruits. Well, that's a very good goal for you for next time. So the next time in 6 months when I see you, we will touch base again and talk about your nutritional counseling and make sure that everything is going well for you. So we will touch base then, and then we will also take a look at your dentition and make sure everything is healthy again the next time I see you as well. Well, thank you for coming in today. It was such a pleasure to educate you on things that you weren't aware of, and also reach out, like I said, if you have any questions in regards to what we discussed today. Okay, well, I will see you in 6 months here. Thank you again. And also, after the appointment, we will document any rationales for the dietary analysis that we have, as well as the results of dietary analysis that we recorded for today and the things we discussed today in this appointment. Thank you.